Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Nigeria celebrates World Health Day as federal government plans to strengthen healthcare delivery. Adamawa State says it has vaccinated half of the target population in the first phase, assures residents of second dose. And Brazil records more than 4,000 deaths over a 24-hour period for the first time as more contagious variant cases surge. Health is a human right. Today, the world marks Health Day on the 7th of April annually to create awareness of a specific health theme and highlight a priority area of concern for the World Health Organization. Under the theme, Together for a Fairer, Healthier World, the WHO says the COVID-19 pandemic has hit all countries hard, pushed more people into poverty and food insecurity, and amplified gender, social, and health inequalities. The body is using the occasion as part of a year-long global campaign to bring people together to build a fairer, healthier world and mobilize action to attain better health for all, leaving no one behind. In Nigeria, the rate of daily infections has remained relatively low in recent times. According to the update published by the Nigeria Center for Disease Control, NCDC, yesterday, the country recorded 58 new infections from 11 states. Lagos, the epicenter of the virus, had the highest figure with 32 new cases, followed by Kaduna and Enugu, 5 and 4 new cases each. And you can see the list of the other states in front of you. Now, the latest figure is lower than the 135 recorded in the previous 24-hour cycle, raising the total number of infections to 163,388. So far, no coronavirus-related death has been recorded in the last 24 hours, as has been in the past 5 days. The fatality toll in the country remains unchanged. Now, 1,585 patients were said to have recovered from the infection, which includes over 1,000 community recoveries in the Federal Capital Territory, 496 in Niger State, and 52 cases in Bauchi. Total tests carried out in Nigeria since the beginning of the pandemic stands at over 1.8 million, and there are 7,700 active cases on admission across the country. Meanwhile, almost 1 million Nigerians have received their first dose of the Oxford AstraZeneca vaccine. Now, in an update by the National Primary Healthcare Development Agency, Lagos is taking the lead as it has vaccinated over 164,000 of its eligible population. This is followed by Kaduna, Kano, and Ogun states, which have vaccinated more than 50,000 targeted clients. Now, most of the states in the southeast have vaccinated less than 10,000. States like Abia, Anambra, Ebonyi, Enugu, and in the south, Akwa Ibom and Bayelsa. The Nigerian government also received another 100,000 doses of COVID-19 vaccines from India. This according to the Presidential Task Force on COVID-19. The vaccines are meant to boost the number of Nigerians to be vaccinated by about 50,000. Over in Adamawa State, the Primary Healthcare Development Agency there says it has recorded significant progress in the vaccination of COVID-19 in the state. This was disclosed by the chairman of the agency in Yola, the state capital. According to him, out of the over 59,000 doses of vaccines received, the state has achieved 50% mark, vaccinating about 28,000 individuals in the Phase 1 exercise, which also includes about 1,500 intending pilgrims to Saudi Arabia.
We are on course. We are not working in a vacuum. We are working within the federation. MPSCAD has been giving us directive on what to do at what point in time. So right from the very beginning of this rollout, MPSCD made this clear that we are using the 4 phase of immunization, and the vaccines we were giving was for us to start the first phase. And when we started the first phase, when we have reached 50% of when we have reached the 50% mark, meaning that there is a first dose and second dose. So right now in Adamawa State, we have adequate doses to ensure that whoever got the first dose will get a second dose. By the end of phase 1, we move into phase 2. Phase 2 has a different targeted audience, 50 years and above, and 18 to 49 that have some comorbidities, diabetes, hypertension, asthma. So we are on course.
The federal government is creating an emergency medical system at no cost to users at point of care to improve primary health care, as well as support states with functional general hospitals, as some measures meant to increase equity of access to health care for the citizenry. The Minister of Health, Dr. Osage Hanure, gave the assurance at a press briefing in Benin City, the Edo State capital, on the occasion of the World Health Day, noting that the lessons from the coronavirus pandemic require strengthening of the health sector. He also explains that the issues which led to the resident doctors' strike are being addressed and the strike will be called off soon. In the meantime, the World Health Organization country representative, Dr. Walter Kasadi, who was also at the event, spoke on the importance of accurate data collection in ensuring access to healthcare for the different groups in society.
A key challenge in overcoming inequities is that there is limited data showing who is being missed and why. To address this, national health information systems need to capture age, sex, and equity stratified data. This information can then be used to inform decision and policy making.
The federal government's next level agenda provides for mandatory health insurance for Nigerians to guarantee a basic minimum package of health services at no additional out-of-pocket cost to citizens. This basic minimum package of health services has been expanded to include service at general hospitals, not only at primary health care centers. To this end, the federal government will support states to reactivate their general hospitals. And while we're looking for one primary health care center at every political ward, we're looking for one functional general hospital in every local government. The health funding mechanism in the next level agenda complements the President's ongoing rehabilitation of the primary healthcare centers, and the model for such primary healthcare centers is available. We have standardized the model of what a primary healthcare center should look like. In addition to that, there is the emergency medical service and ambulance system that is under construction. The entire policy and framework is under construction to support access, physical access to hospitals and care centers, especially at odd hours of the night.
Well, we go over to Cross River State to find out what shape vaccinations are taking there. And joining us via Zoom is the Commissioner for Health, Dr. Betta Edu. Glad you could join us on the program.
Good evening. Thank you for having me.
All right. Tell us, since the vaccination started, have there been any adverse effects?
So we have not had any serious adverse effects following immunization in Cross River State since the vaccination exercise started in our state. We have vaccinated well over 25,000 Cross Riverians, and this is a little above half of what had been supplied to the state. And we have actually put the vaccination process for this first phase. We brought it to an end. We've put it on hold so that we can use the balance of the vaccines that we have to give the second dose to everyone who has taken the first dose at least 6 weeks down the line.
So you're saying no serious cases. How about mild cases? What are some of the mild cases that recipients you're getting from recipients?
So basically, we've had people calling with mild fever, which was managed with just paracetamol. We've had people calling with headache, and then, of course, some people have had some form of discomfort around the site where the vaccination was given. But generally, we've not had any serious case where we've had to use the adverse effect following immunization kits, and we've not had a serious case where the contact numbers on the cards were called because there was a situation at hand. So really, we've not really had serious cases in Cross River State following the vaccination, and we've really done a lot. But of course, for today, which is the World Health Day, beyond the vaccination, we in Cross River State are looking at system building, including the insurance, which would ensure that people can have access to quality healthcare services, people can have equity, and of course, there's unhindered quality health services rendered to people all across the state. And this is the way for Nigeria to go right now.
As much as vaccination is ongoing and the world is fighting the pandemic, looking at the other measures, the NPIs and also testing, is that still ongoing as well?
Oh, definitely. A lot of testing is ongoing, community sampling. We're happy that USAID came into the picture and they are supporting to move samples from the local government and the different sample sites to the state headquarters where the various, the 3 functional labs are testing for COVID. And of course, once the samples are sent in, the test results are sent out. We've had to stretch the vaccination even beyond the health workers. After we had covered the health workers, we had to look at certain strategic leaders who can take the message down to the grassroots. So testing is going on, vaccination is going on, isolation and treatment for people who need it is actually ongoing in Cross River State.
I must ask, because the Nigeria Association of Resident Doctors, the strike is ongoing and it is nationwide. Isn't that affecting healthcare in Cross River State?
It definitely is affecting healthcare in Cross River State, and it's affecting healthcare in Nigeria. A lot of work has to be done around human resources and making a comfortable environment for Nigerian doctors to thrive. We need to reduce the brain drain out of Nigeria, and we need to encourage them, give them the right incentives to push on. They're asking for the basics, and we hope the government, the federal government, can provide that almost immediately. The state health facilities do not run residency programs, and so they're going on, and there's no interruption to service at that level. But for the tertiary institution, which is the University of Calabar Teaching Hospital, the resident doctors have been on strike, and it's definitely affecting the treatment center and the isolation center, which is located there. So really, we hope that as the Honorable Minister have said, they can resolve whatever issues they are with the residents and they can go back to work as soon as possible. We need to be able to build a fairer and healthier world. And by doing that, we shouldn't be having so many strikes in a health sector that is fragile.
Indeed, Dr. Betta Edu, always a pleasure. Thank you so much for joining us on the program, Commissioner for Health, Cross River State.
You're welcome.
In Ekiti State, the first phase of the vaccination of frontline workers across the state is continuing, with sensitization still in progress as medical experts and top personalities continue to encourage citizens not to reject the vaccine. The Chief Medical Director, Federal Teaching Hospital, Ekiti, says the facility has made a feedback assessment of the first 500 frontline workers vaccinated with no serious side effects reported.
From the time immemorial, we've always been combating epidemics, especially from infectious diseases, using vaccine. This one would not be an exception. So I encourage Nigerians to avoid this hesitance and come out and get the vaccine. If you don't protect yourself, you are exposing the other person. Because whatever affects you has the capability of affecting the next man to you. So you can't say, I don't want to take the vaccine. All of us should be interested in taking the vaccine. Because it is when you take the responsibility of protecting yourself that you are also helping the next man to you to avoid being a victim of the infection, of the virus. So I plead with Nigerians to have faith in medical science. Come out, take the vaccine. I've taken my own, the first dose.
Still to come on the program, UK's vaccine advisory body says under 30s are to be offered an alternative COVID-19 jab. Find out more when we return. Welcome back. The UK's drug regulator, the MHRA, says people under 30 will be offered an alternative COVID jab to the AstraZeneca vaccine due to evidence linking it to rare blood clots. It comes after a review that found by the end of March, 79 people in the UK had suffered rare blood clots after vaccination, 19 of whom had died. The regulator says although this is not proof that the jab caused the clots, the link was getting firmer. Here's more on our global update.
All 79 cases, according to the MHRA, occurred after the first dose. 19 of them died. Of the cases, 51 were women and 28 men, aged 18 to 79 years old. And the risk of this kind of side effect is about 4 in 1 million to those who receive the vaccine.
Well, I haven't.
The regulator, however, says the benefits of the AstraZeneca vaccine outweigh any risks.
It's very clear from everything I've seen and read that the risk of this thrombotic complication, the blood clotting, if it is in fact cause and effect linked to the vaccine, is very, very much lower than the risks associated with coronavirus infection itself. And we must bear in mind too that COVID-19 infection does carry with it a very considerable increased risk of clotting events.
Meanwhile, the EU drug regulator, the European Medicines Agency, says it has found link between the AstraZeneca vaccine and blood clots.
The Prague, after a very in-depth analysis, has concluded that the reported cases of unusual blood clotting following vaccination with the AstraZeneca vaccine should be listed as possible side effects of the vaccine.
German Chancellor Angela Merkel supports demands for a short, tough lockdown in the country to curb the spread of the coronavirus as infection rates are too high. The country is struggling to tackle a third wave of the pandemic, and several regional leaders have called for a short, sharp lockdown while the country tries to vaccinate more people. Over in France, the Stade de France, the national stadium, which once hosted football's World Cup final, has been turned into a vaccination centre. The stadium aims to give 10,000 jabs each week and is open Monday to Saturday from 9 a.m. to 8 p.m. Health workers in Peru are protesting labour conditions as they battle to cope with the second wave of the COVID-19 pandemic. The doctors and nurses are demanding medical supplies, more beds in intensive care units and vaccinations, as well as better working conditions and pay. Finally, a 104-year-old woman from northern Colombia has recovered from coronavirus for the second time. Carmen Hernandez received an ovation from hospital staff as she was discharged after spending 21 days in the hospital fighting the infectious disease.
Wow. Well, joining us for more on this is Dr. Peter Moesi. He's a research fellow, University of Aberdeen, Scotland. He joins us on the programme via Zoom. Thank you for joining us.
Thank you for having me. Good evening, Nigerians.
I want to begin today with the EMA briefing on the assessment of the Pharmacovigilance Risk Assessment Committee of the COVID-19 AstraZeneca vaccine and its relation to the thromboembolic events, the blood clots. What did you make of the report?
I think the report of the EMA kind of consolidates the role of regulators. And that, for me, I think it's more like bridging enhancing the trust between the population and also the regulators as well. So for me, I think it's a win-win for people to know that of a truth, we have a watchdog that is actually out there trying to put the people's interest at heart. So that's the way I see the report. And I think it's also commendable as well.
They also went ahead to say that the benefits of the AstraZeneca overall outweighs the risks of side effects and that the vaccine is highly effective against COVID-19. But do you agree with this in light of some of the revelations as well that no definite cause was found, no specific risk factors, and they can also recommend specific measures to stopping the blood clots?
I think I'm going to take your question in three parts. The first part is the benefits outweighs the risk. Of a truth, yes, that is true. When you look at the age demographic here in the UK, we've inoculated people who are 60 and above, and there's increased reduction in hospitalization, severity, and fatality as well. So of a truth, within that particular age bracket, you could say the risk and the benefit outweighs the risk. But when you go down to the next spectrum of the younger population, I'm not so sure I can say that as well, because when you look at the pandemic itself, this particular pandemic has not really had a firm grip in the younger population. And this also underscored the current report or recommendation from the Joint Vaccine Immunization Committee today, which is the JCVI, that's kind of pegged the vaccination of AstraZeneca from people who are 35 and above, who are 30 and above, then people who are 18 to 29 are restricted from taking this jab. And the second part of the question is when you talk about the definitive cost of the vaccine to the cases we have. So based on the EMA report today, we are told that there is a possibility of immune response that is similar to what you have when it comes to the heparin-induced thrombocytopenia. So that's the mechanism you have there, that this may be the possible link that leads to the blood clots you have, or the rare blood clots you have as well. Then finally, on that same question you asked, is the aspect that has to do with the reduction in blood clots when it comes to the treatment. And based on EMA report as well, they were also saying that health workers should be very careful not to go about using heparin treatment, because as we speak right now, there's no definitive treatment regimen for these particular cases. However, people are meant to be aware of the possible side symptoms you may get. Number one is chest pain. 2 is swelling of the leg. 3 is redness in the area where you have your jab. Then 4 is shortness of breath. So these sort of symptoms should be well communicated to the members of the public, at the same time to the health regulators as well.
So, looking at all of these investigations, the report, could one say that it's as a result of the challenges posed by large production of vaccines or fast-paced production?
That is a tricky question, right? It's neither here nor there. But first, you need to understand that when it comes to the production, you may likely have glitch here and there when it comes to large production, because this is the first time we are massively producing a drug at this scale in the world. But when you look at the other side of the divide, you could also say that the science was duly followed. For instance, for the AstraZeneca, we have the clinical trial phase 1, phase 2, and phase 3. And also there was also the preclinical trials as well. And you can also recall that in the US, there's also this particular trial that was reported in the US recently. So all the science was duly followed. But as you know, when it comes to drug or vaccine, there are always issues here and there where people may likely pick up possible adverse effect or side effect as well. So I won't say that the pace has anything to do or the large production, but no one can rule out both angles. But for the science, I would say the science was duly followed, and these particular findings were published in reputable journals in the world.
So essentially, more studies, more research in the updates. We'd like to thank you, Dr. Peter Moesi, is a research fellow, University of Aberdeen, Scotland. Thank you for joining us on the programme.
Thank you for having me.
And it's a wrap here. Continue to take responsibility. You can find more updates, a better understanding of the pandemic on our website. That's channelstv.com. That's the programme this evening. Thank you for watching. I'm Millicent Nwaka. Stay safe.